The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And today, our guest is Dr. Sunil Raj. And third session will commence at 9:30 to 10:30. That is our Hindi session. Sorry, that's our Malayalam session. All these sessions are going in a good way, and we are getting very good professionals from homeopathy fraternity as well as from the international level also. Today, let me introduce the guest of the day, Dr. Sunil Raj R. Dr. was the senior superintendent of homeopathic department from Kerala, and he has served in various levels from a medical doctor to medical officer to superintendent. Lot of activities in Kerala government sector. As you all know that this is one of the best place where homeopathic is flourished in government sector. And Dr. Sunil Raj was the former secretary, general secretary, president, as well as worked in various posts in Government Medical Officers Association. He has done lot of presentation with the homeopathy fraternity as well as for the general public also. He was the front person doing lot of medical camps as well as awareness classes for general public also. And today, the doctor will be talking about management of fever, homeopathic perspective. That is another big subject. Hope all of you will be here enjoying the beauty of homeopathy from Dr. Sunil Raj. We welcome you, doctor. Yes, you are. You can unmute. You are the co-host. Yes, yes, I shall make you. Yes, you are the co-host now. Please unmute.
A warm good evening and pleasant good morning and good afternoon to all the participants here in this platform. And thank you, Dr. Dinesh, for a nice introduction of me. I am appreciating the IFPH for their sincere and dedicated work in this scenario. Uninterrupted classes and completing 4.5 years. Very nice work, and I watched this in this session also. It was also very nice, and you are promoting all the junior doctors and senior doctors, and you are ready to share the experiences. It's a very nice job you are doing. Thank you, IFPH, and I thank IFPH for giving me an opportunity to present this topic before you. Can I share the?
Yes, sir. No. Please reshare. It has not come.
It is not coming.
No, sir. You may withdraw the same and then reshare it. You may withdraw the same once again and then reshare it. Stop screen share. Ah, yes, it's coming now. Yes, open now. It's open now. Now you can.
I'm not getting my screen.
No. You may stop screen sharing and restart it again. Now it's okay. Now you can go.
Please select your file, doctor. The PowerPoint, is it PowerPoint?
Yes.
Yes.
We can see the top.
Okay, we can see. Okay,
Ah, yes,
open.
yes. Okay, okay.
Okay. Okay, it's fine.
So this is a topic, management of pure homeopathic perspective. See, I selected this topic because I want to brush up the knowledge of myself and all the doctors present here. And also I'm ready to convey my experience in this field. See, I'm paying my tribute to Dr. Samuel Hahnemann, who is the master of our system of medicine. And he sacrificed his whole life for the protection of health and healthy living and ideal cure. And he's the savior of mankind. So always I'm in favor of, in fond of, or in promoting the words of Hahnemann. See, these are the words of Hahnemann about his doctrine. See, refute these truths if you can by showing a still more efficient, certain, and agreeable than mine. Refute them not by words which have already too much, but if experience should prove it to you, as it has done to me, that my method is the best. Make use of it to save your fellow creatures and give glory to God. See, he is saying that you don't give me glory, you see, give glory to the God. He experimented his own body himself to exploit the nature's law of cure for the mankind. See, by these words, Dr. Samuel Hahnemann is challenging all the systems of medicine in the world. Prove another one in the instead of this homeopathic system of medicine. This is my principle, the first principle of GHMC Toronto, of KJIS. See, as I was the first business student of GHMC Toronto, I was blessed, not only myself, but the batch, 3-4 batches are blessed to attend the OPD, IPD with Isaac sir after completing our first BHMS classes. Here I am pointing out one incident which pierced into deep in our hearts to follow the homeopathic system of medicine, strictly adhering to the principles of homeopathy which Hahnemann preached. See, in one day in the crowded OPD, a child was brought to the OPD in front of Isaac sir. So we all were watching, and the child, 4 years old, came with a 103 degree Fahrenheit fever, and the child is crying, he's ugly looking, and he's throwing all the things, he's beating the person, and while case taking, the mother told there is grinding of teeth also. See, Isaac sir closely watched the case and gave one dose of Sinat and told one of us to take the child to the IPD department and you collect medicine from the nurse and you give personally to this child and ensure that child is taking medicine. Then after 2-3 hours, we went with Isaac sir for the usual rounds. So when we were there, we all are curious to watch the child. See, the child was playing and eating some kanji diet, sitting in the bed, and the temperature came down to 101. So like this, so many cases he showed in front of us. So that they touched our heart, and so we cannot part away from the classical homeopathy. So I think 3-4 batches in the college got the opportunity to attend the IPD and OPD with ICSR. Thereafter, the number of students increased, and he was busy with the administrative work. So I was, not only myself, but the whole batch, whole students were very pleased, and they were following path of Samuel Henry. See, when after joining the medical officer post, I was lucky to get that posting at the Government Homeopathy Hospital, Kannur. So here also I got opportunity to see the result of magic of homeopathy with single doses. So I preached about the ICSR also. See, fever, it's typically a sign of immune system's natural response to an infection or any derangement of health. Normal temperature is 98.6 degree Fahrenheit or 37 degrees centigrade. See, this is the sign of immune system's natural response to an infection or any derangement of health. See, we can see the causes of fever. The first one is the infection. So any infection, viral, bacterial, protozoal, or fungal infection may cause fever. There are various types of virus: rhinovirus, influenza virus, adenovirus, then coronavirus, rotavirus, then Epstein-Barr virus causing the infectious mononucleosis, then cytomegalovirus, then so many viruses are causing fever. Then the bacterial infections, all the infections caused by bacteria causes fever because there is inflammation and there is changes in the pathological condition. So there are almost all the bacteria is causing infections with fever. There is sore throat, sore throat, UTI, then bacterial meningitis, pneumonia, typhoid, then bacterial gastroenteritis, TB. So many diseases are with bacterial infection causing fever. Then the protozoal infections. That's malaria, giardiasis, schistosomiasis. All these conditions infected with the protozoa also causes fever. Then fungal infection also causes fever. Then the second point is autoimmune diseases. That is rheumatoid arthritis, lupus, then ulcerative colitis, then blood clots, pulmonary embolism, deep vein thrombosis, then cancer, some cancer cases, lymphoma, leukemia, ovarian cancer. These are also presenting with fever with other complaints. Then immunization and vaccination also causes fever. Then some medication also causes fever. Then sepsis, septic conditions, wounds causes sepsis. There also we will get the fever. Then heat exhaustion and idiopathic conditions also causes fever. These are the symptoms. These are the common symptoms of fever. Let's deal with shivering, then headache, body ache, fatigue, sweating, then feeling dehydrated, hot skin to touch, then loss of appetite, then flushed complexion, and symptoms specific to a disease. See, these are the common symptoms of fever. But along with, there are symptoms which are pointing towards the cause of the disease. We can see rashes, we can see eruptions in chickenpox, and we can see vomiting and diarrhea in cases of food poisoning or gastritis cases. So the other symptoms specific to the disease reveals the exact cause of the disease. Then we can understand by giving lab test, advising the patient to say, take a lab test or any investigations. So we can see the symptoms and see the pathological condition also. So that's the diagnostic point of view only. The second part is the peculiarity of your unique nature of the homeopathy doctor. The collecting symptoms to know the individual character symptoms of the patient along with this other symptoms of the case. That homeopaths are lucky to show, to give the medicine as per science and with the logical and artistic way. So we are collecting the etiology, causative factors, location, sensation, modalities, and concomitants. And even the uncommon peculiar symptoms also giving us, also pointing us to the exact remedy which is suited to the case. So we are proud of our system of medicine because we are not waiting for the lab results to come on, to roll on. We can directly give medicine after collecting the symptoms. And when we get the lab report, we can assess the state of the patient, condition of the patient, and we can also note the prognosis after testing the lab reports 3-4 days after giving medicine also. So we are lucky to prescribe medicine on the basis of clinical presentation of the case itself. That's the beauty of homeopathy. Even the etiology itself will be leading to medicines. Then we can, if there is a history of getting wet, we can give Rastox, Alcambra, like that. Then if there is a history of food poisoning or any sort of like that, we can start with medicines, Naxomic or Sal, as the symptoms agree with the case. So we are doing a double work. We are noting the symptoms to diagnose the case, to establish the name of the disease, and also we are noting the individual character symptoms to note the, to get this correct minimum suitable to that case. So we can here I am presenting some investigations also. If it's a typhoid case, we can do the Vidal test. Then the RT-PCR and immunoglobulin studies for the viral fever and fever caused by the virus infection. Then in treating the cases of fever with autoimmune diseases, homeopathy is holding a very good chance or
Excuse me, doctor. I think slides are not moving.
okay, I'll move that slide.
Okay, yes.
So in the autoimmune disease cases also, we are lucky to have our medicines to our tasting itself goes to the deep into the patient genetic history also. So we are lucky to have some medicines to deal with the autoimmune disease cases also, where the other systems of medicines are actually wondering how to go ahead with this. Then other beauty of the homeopathic system of medicine is when in some cases where the eruptions are failing to come out and the patient is always giving medicine for fever, first day, second day, third day, fourth day, but the fever is coming and going. So in that condition, we can notice whether it may be due to some eruptive fevers. There also we have wonderful medicines to combat these situations. Then we can give medicine simply noting the tongue also, and that is also a beauty of homeopathy. We can not be simply noting the tongue of the patient suffering from sleep fever. Also, we can prescribe medicine. So we got Rustox with red triangular space at the tip of the with metallic taste with the flow of saliva. So when the teachers were saying like this point in the class, we were not ready to digest that point. How we'll get there? But in practice, so many cases we got with the red tip of tongue. Then in natural cases, mapped with red insular patches. Lactus is constant protrusion and retraction of tongue like a snake. Then mercurius, large plan shows imprint of teeth, profuse salivation. Then in mercurius cases, I will deal all this when we discuss the medicine part of this fever prospective study. Then the complications. So the febrile seizures are the very worst condition. It's not the worst condition, but the people are very afraid of febrile seizures. When the child with below 1 or 2 years age is showing the febrile seizures with fever, the parents will be very sad, and they will be in a hurry to reduce the temperature at any cost. So that is the, but with our medicines, we have got good medicines to combat the febrile seizures also. So in our hospitals, we got in all the hospitals, we got the nurses, GNM nurses are there. So we can admit any type of cases because the nurses are well qualified in their nursing duty. So they will be watching all the vital signs and they will be reporting all the emergencies. That's the beauty of admitting patients in our wards. So the febrile seizures can be controlled with the even necessary management also. In our medicines, very good medicines that we got. It's stramonium, calcare carb, are good medicines to combat with the febrile seizures. Then the complication is to the specific organ affected or affected by the specific organism. That part we have to be careful, because that's why we are doing the lab test and all other investigations to see what is the damage that organism or that infectious agent is causing to that patient. So with the lab reports, X-rays and the other investigations, scanning and all, we can notice how much damage is the organism is producing inside the body. So the complications has to be dealt with most care, and with our medicines, homeopathic medicines, there is a less chance of going to complications. So we are seeing some cases in the after 20-40 years, they are coming with the infertility problem in our OPD, and when we are searching for the history, the man will be saying that I got mumps at the age of 4 or 5, and it was treated by some other medications other than homeopathy. So that may be a cause for this infertility, and like this in case of female also. So our medicines, homeopathic medicines, have got a very good capability of preventing such complications, such metastasis of the disease also. Most of the cases we have to is there any liver damage, is there any splenic involvement? So we have to check all these things with confirming the clinical with the lab investigations done to that case. So we cannot blame the system of medicine for not doing the timely lab investigations. So we have to do all these things to give assurance to the patient, and we have to get assured ourselves also about the damages that the infection may cause or it may be causing. Then the personal susceptibility also. Third point I am saying that complication, personal susceptibility. Some patients are very weak patients. Some persons are easily susceptible to the infections. So that we should be cautious. We should be bear in mind to look the patient's susceptibility to the disease. And in these cases, the personal susceptibility is a very good response to our medicines in favor of them also. So we have to be sure with the person. While we are taking the case, we are going back to the history of the his father, family history and all. So we will be getting a chance to know the person, all general condition and his internal conditions also. So is there any chance of getting any serious involvement of the organs of the person also? We can able to trace out. And this is the general management. First one is the remove the exciting cause. That is with the topmost importance. Otherwise, there is no need of there is nothing to chance to go ahead, because when the existing cause is there will not be any improvement to the case. So we have to remove the exciting cause. Then advise complete rest. So we have to advise the patient to take complete rest. Then take plenty of water. As the fever is causing dehydration to the patient, ensure the patient is taking enough amount of water. Otherwise, there will be chance of getting the organs involved without getting sufficient water. Then the lab investigations. So we have to go through all the lab investigations in all cases of fevers to know what is the harm doing by the organisms to that patient. Then there are specific tests also there. I told that in case of typhoid viral test, then the viral diseases are PCR. Then so many specific tests are there. Then the hygienic condition. So we have to teach the patient and the family what the hygienic condition is playing the role in their health. So in the COVID taught us a very good lesson of hygiene. So even our Master Hanuman is very adamant about this hygiene and the place of living. Then the seventh point is good and nutritious food. So we have to advise the patient to take very good food, which is easily digestible to that condition. We are advising the patients to avoid the oily food and rich food during the attack of fever, because the patient's digestive system will be also very weak, and they are now not able to digest all these things. So if there is food, if the food we are giving is good and nutritious and easily digestible, then the patient's condition will automatically improve with the good food and nutrition. Then avoid visitors also. See, in most of the areas, the visitors are the main problem. Visitors are visiting to just place the patient and family. It's not like that. Patient needs rest, complete rest, and try to avoid the visitor, because in case of fever, with these infectious agents, especially the virus infections, there is a good chance of spreading the disease very easily. And the patient also need rest, and to avoid the spread also, it is wise to avoid visitors. Then strictly follow the advice of the doctor and the paramedical staff. We have to be very strict with the advice of the doctor and paramedic staff in dealing with we have to make sure that the patient and bystander is strictly following the advice of doctor and paramedic staff. Then homeopathic management. See, in acute cases, especially in fever cases, aphorism 3 is very important. We have to know the disease condition, then knowledge of the medicinal power, choice of remedy, then proper dose, repeating the dose, and obstacles to recovery in each case. Of course, we have to know the constitutional background also, because in some cases there will be acute exacerbation of the chronic condition. So we have to go to the we have to take the case in detail also. But aphorism 3 is very important in dealing with acute cases, especially fever cases. Then aphorism 7, causations and total symptoms. Then I told earlier that etiology itself points to the remedy we are searching for. And by collecting the symptoms, totality of symptoms, we are getting the exact picture of the patient and what is the present condition and what are the things patient is in need at that moment. We'll get a total picture of the symptoms, picture of the patient itself. The subjective and objective symptoms and all the symptoms told by the bystander are pointing towards the exact minimum in that case. And by collecting total symptoms, we can choose the remedy and we can choose the proper dose and we can choose the repetition of the dose also. And also, it's a very important point that we can remove the obstacles to cure also. Then the uncommon peculiar symptoms. We can give medicine even based on the uncommon peculiar symptoms alone. Then the aphorism 235 to aphorism 244, intermittent fever. In this aphorisms, it is it has pointed all the conditions of intermittent fever, sporadically and epidemically spreading fevers, then different stages, and at what time we have to administer medicine. All these symptoms, all these are very elaborately discussed in these aphorisms. Aphorism 241 is pointing out why we are selecting the genus epidemicus. So in epidemics of intermittent fever, in situations where none are endemic of nature of chronic diseases, composed of single acute paroxysms, each Single epidemy is the peculiar, uniform character common to all the individuals attacked, and when the character is found in the totality of symptoms common to all, it guides us to the discovery of homeopathic remedy suitable to the case in hand, and it may be acting as a genus epidemics also to prevent the spread of fever. Version 245 to 251 is about the repetition of medicine in all these cases, in acute cases and chronic cases. So we are coming to the homeopathic remedies. So I wrote all these medicines in one page. The first one is aconite. That is with anxiety. So these are the prescribing points to prescribe aconite. Its acute onset is a very important one. Exposure to dry cold wind. Anxiety, restlessness, bounding pulse, thirst plus red face, chilliness are pointing towards the remedy aconite. Then the second one I noted belladonna. High temperature, no thirst, bursting type of headache. And usually it was caused by working or walking in sun. Skin hot, burning, heat followed by sweat, then eyes red and glistening. That's the exact inflammatory condition. Then Bryonia alba. That's caused fever causing by after chill from getting wet. Fever aggravation before midnight. And there is dry cough. Dryness is a very good point to come in favor of Bryonia. Thirst. Dry cough with pain all over the body. Ambulation by complete rest. A slight movement will be causing pain, headache, and thirst for large quantities of water at long intervals. Then I got opportunity to treat cases with I used to give, if the patient is coming with vomiting and fever, with constipation with no urging for stool, I used to give Bryonia. We are getting very good result. And Bryonia is a very good medicine for German measles also. Then arsal. Fever with cold, thirst for small quantities of water. And peculiar type of arsal is burning outside and cold inside. Fever aggravation after midnight. So weakness is also a very good point for prescribing arsal. Then there is prostration, rigor and chill. And arsal is a very good medicine for taking contaminated food poisoning. It's a very good medicine for the food poisoning. Then Rustox. The body pain is the very good indication for Rustox. Constant chilliness, restlessness, and the patient doses dry tongue with hard tickling thumb, weakness and soreness, and or bruised sensation all over the body. So we can use this medicine in the early stages of typhoid with the reduced appetite and dependence to food. We can use the medicine in the early stages of typhoid. Then gelsemium, we were studying the gelsemium with 3D, dullness, dizziness, and drowsiness. weakness and desire for absolute rest, headache of violent nature, muscular soreness, great prostration. Then baptisia is a very good medicine for throat infection, fever with throat infection. And there maybe you can see putrid ulcers in the throat. Chill at 11 a.m. Talkativeness with high temperature, baptisia. Stupor, diarrhea is period also. Falls asleep while answering a question. Low delirium, prostration, sleepiness and restlessness. Baptisia, I mean, most of the doctors are prescribing baptisia tincture or creates. It's also a very good medicine for in the initial stages of typhoid. Then Epitorium. Epitorium is famous for the chikungunya preventive and for the treatment also. Epitorium for. That's a peculiarity is chill followed by vomiting. Vomiting of bile. Headache with throbbing, with nausea. Deep pain in the bones, amelioration with pressure, hoarseness and loose stuff. And the ninth medicine is Dulcamera. Here, it may be caused by the getting wet in rain. Eyes suffused, throat sore, cough with muscular soreness. Then causticum, it's a very good medicine for fever. High fever and hoarseness with dry cough is there and nose is stopped. Then causticum will act. The next one is Naxomica. Naxomica is a very wonderful medicine in dealing with fever. That chillness. You cannot move away his blanket or his covering. And constipation, inefficient charging for stool. Extremely chilly patient. Obstinate constipation. Bitter taste in mouth. Whole body burning hot and prefers covering. Then Pansarla. Here it is sour vomiting of ferment or bite. Still at 4 p.m. Hot head, dry lips. Chilliness all over. Aggravation evening. Intolerable burning heat at night. Headache, diarrhea. Absence of thirst is a very characteristic symptom for the Pansarla case. Then Arnica montana. Heat and redness of the head with coolness of the rest of the body. Internal heat, feet and hand cold, nightly sour sweats. Then Cinna. Cinna is a very wonderful medicine for fever in children. If there is any sort of home, small pinworms are there and showing any sort of mental disturbances, and we can go for sin. Then carbohydrates. So in carbohydrates, there is a desire for cold water, tastelessness during fever. Carbohydrates is a very good medicine for typhoid stages. Then Maxol. Maxol, peculiar to Maxol is aggravation of fever at night, weariness, prostration, trembling, profuse perspiration without relief. Patient is saying that I was drenched in sweat, but there is a fever coming back in the morning. Profuse salivation also is there in Maxwell cases. Then gastric and bilious nature, swollen glands in inguinal, in this one, this throat, cervical glands, swollen. Maxwell is a very good medicine. Then nitric acid. Nitric acid is a very good medicine for neglected cases of fever. If there is small ulcers in the periphery, in the tip of tongue, we can think of nitric acid. Then lycopodium is a very good medicine for fever with gastric complaints. So here the chill begins at 3 and 4 p.m. Evening aggravation is very prominent in lycopodium. Icy coldness is there. One chill followed by the other. Then evening aggravation is very prominent in lycopodium cases, and it's a hot patient preferring for hot food and hot drinks. Then ipecac. Ipecac is the gating symptom is the nausea. There is a cough, and if there is a loose cough not coming out, ipecac will give good results in case of fever with rattling cough. Then soranum is a very good medicine. It's a very good nosode. We can give this nosode if there is no response to fever in or indicate medicines. We can give integral dose of soranum. And if there is in septic condition also, if there is pus, we can give soranum. We got very good results with soranum in case of this ulcers with pus and fever. We get very good results from soranum. And the peculiarity of soranum is boiling sweat is there.
Excuse me, doctor, this may take a long time. We have to finish in time. Okay, no,
okay, then this one is the pyrogen. Okay. What's the time now?
Only 10 minutes.
Okay, then I will be speaking up. Then this one, pyrogen is a very good, very good nosode. We have when we got septic conditions, not responding to medicines, and pyrogen is very good medicine. Even in case of streptococcal infection, also for the throat is going to a septic stage, not responding with medicines, we can give 1 or 2 doses of pyrogen as a nosode, as an integral medicine. Then sepia is also very good medicine, and the constitution itself goes to the point about the sepia condition. Then sulfur is a very good medicine, but our teachers used to say in the classes that don't give sulfur. It will spoil the case, because we will not be looking for any other symptoms for the fever. We will be blindly giving sulfur. So try to get a medicine which is point with the total symptoms. Don't give blindly sulfur or like that. So we have to collect the symptoms to get the suitable medicine. Then natronol is a very good medicine with the blisters in lips. Then ignitia, the complement of natronol. Then phosphoric acid is a very good medicine for complaints, even with the typhoid complaints, even after the complaints also after the typhoid treated by allopathy system also, we can give phosphoric acid to prevent the further complications. I got cases with the falling of hair after typhoid. That was dealt with acidity, phosphoric acid very nicely, and it was a very wonderful medicine, phosphoric acid, and it cures the weakness resulting after typhoid. Also, it is a very good medicine for covering the weakness of patient after typhoid. Then HEPAR there is eruptions with pustules and all. There is a severe pain. HEPAR is very, very good medicine. The patient will not allow us to come near the patient. Test the part. HEPAR is a very good medicine. With fever, I'm sure HEPAR will act wonderfully well. Then lactic acid. Then antidote, Adam is I got opportunity to cure many cases of children, small children with asthma, with they are hot in nature. The patient will not allow recovering, but suffering from asthma. Adam, very good medicine. With the high temperature, asthma with the high temperature, iodine is doing wonders. Then totalis solidus, there is this is a very good medicine for the yellow fever, black point, low delirium, yellow skin, oozing of blood from every orifice. Totalis solidus, very good for food poisoning also. Then AP smell is for it is given that is for Calasa. Then the stramonium is very good medicine for combating the epileptic attacks and nightly painful cries from the patients. There is with fever we can give stramonium. And Episcan. Episcan is a very good medicine in gastric complaints. Lactic acid is the fever blisters studded with vesicles with a red base. Lactic acid is very good medicine. Natural or intermittent fever, like pearls about the lips, dry, cracked, and ulcerated. That nitric acid also covering this point. Lips dry, cracked, and ulcerated. Then echinacea is a very good medicine for I am using as a specific with cases increased ESR. It's very I am getting 90% success if the patient has blood vessel with increased ESR. Echinacea will do wonders. Then phosphorus was a very good medicine that if there is no sweat and intense heat, phosphorus will develop, definitely help. Then veratromid, very good medicine for fever with severe headache. And the meningitis cases, veratromid is very good in meningitis cases. Pain, nape of neck, chai, white or yellow with red streaks. Hiccup, excessive and painful, scanty and urine, veratromid is a very good medicine. Vitis with the itching of the throat, thirst for icy cold water during chill. That's the uncommon peculiar symptoms for the Vaidya cases. Thirst for ice cold water during chill. During sweat, profuse sweat at night. And malaria cases. Vaidya is a very good medicine for malaria cases.
Yes, sir. Sir, our time is about to finish and we need a discussion on the subject also. So we will have the second part of the same on the 4th itself. So let us close the session for some short discussion because there are people who want to participate in discussion. Please let us stop sharing and then we can go ahead with the discussion. Already Dr. Indrani Bhadwakar has raised the hand, so you can directly speak now because only 4 minutes remaining here.
Yeah. Sir, in a very short time, I will ask. Thanks, sir, for your lecture. Actually, we face a practical problem in fevers, which is the exact time to administer a homeopathic remedy in fever cases. Means, is it during heat, is it during chill, or is it during sweat? That is the main difficulty for many homeopaths. So kindly guide us for this.
See, so we have to deal with the case at when the patient approaches, we have to deal with the case, no? If there is intermittent fever, it's the apt time for giving the medicine. Is between the exacerbation of the fever. And when the fever subsides, in that time we have to administer the medicine.
Okay. Actually, it's a lucid interval. And Dr.
Yes,
Haniman said in FY 238, after the sweat, you should give a medicine. So
yes,
is
yes,
it okay?
yes.
Okay, sir. Thank you. Thank you.
Yes, Dr. Harihan, sir, you want to speak anything? Do you have a question? Yourself. Yes.
Okay, dear Sunil Raj. Very good,
Thank
very
you.
good, sir. Very good research, very good session. You continued almost all fever medicines. But in my practice, I have a very little medicine, say, for this fever. Easily I can manage any fever condition I can manage, because in short time usually I will repertorize the case if in difficult cases. Difficult cases I will reply. Anyway, it is a good task, and see almost all doctors will be benefited by your class. Okay, thank you very much. See, we have in Beratramber, you said about the meningitis. See, in Beratramber also, if that patient is going to be the pneumonia cases prior to pneumonia, Beratramber is a wonderful remedy.
Yes,
See,
sir.
Meningitis cases also, meningitis also.
Yes, sir. We can have a discussion on the second part of the 4th of February, so that Dr. Harihan sir can give more input into the session, and so that more people will be benefited out of it. And it's up to Dr. Ramraj sir to say a few words in 1 second, and then Dr. Manoj will say vote of thanks.
Thank you, Dr. Ganesh ji, and everyone. Namaskar and congratulations, Dr. Sunil Raj, or IFPH Secretary, Dr. Sunil Raj ji. Very, very thanks. Very nice presentation, excellent session. Fever is describe the very kinds of medicine, but fever is a not disease. Fever is a not disease. Fever is a energy, body energy. Fever, body energy. Cause, so fever, very good sign for ill. So very, very thanks, Dr. Sunil Raj ji. Thank you, sir.
Thank you, sir. Thank you, sir.
It's a time for wind up the session. I invite Dr. Manoj to say vote of thanks.
Thank you, Dr. Sanesh, Dr. Sundar, and all those presenters. Nice presentation. And we all know that homeopathy is a lone solution to tackle the fever cases, because whether it's a viral or bacterial, whatever it may be, with clinical presentation and etiology, it is most easy. Moreover, especially in the case of children, it's very easy to administer medicine also. So, one nice presentation altogether. On behalf of IFPH, expressing sincere thanks to Dr. Sunil Raj and all those participating in the session. Thank you.
Thank you, Dr.
Thank
Manoj.
you. Thank you.
Sunil Raj and to participate in the session. Tomorrow, we will have a session from Dr. Professor Vaidehi Bhatt. She is the HOD and Professor, Department of Homeopathy Pharmacy, LR Shah Homeopathy College, Rajkot, Gujarat. And she will be talking about unmasking the enemy, insight into viral fever. So another day is waiting for the same session, as we can continue the same session as if. Anyway, hope all of you will join tomorrow. Those who miss the session can watch the videos of the same tomorrow itself by searching YouTube IFBH Homeopathy. Thank you all. Good night. It's over to Dr. Bindiraj to moderate the Malayalam session.